paying half of the health care bill through Medicare, Medicaid, the Veterans Administration, the Department of Defense, local and government health plans, and the Bureau of Indian Health. They're already paying half of it, but it's based on a very wasteful, profiteering, and benefit-denying system. But what is not mentioned very often in terms of numbers is that if we had a single-payer system, none of this cross-billing, none of this one secretary per doctor dealing with the paperwork, etc., we would save $400 more billion a year. Which is one of the reasons why doctors increasingly support single payer. So, here are the advantages of single payer quickly. Number one, everybody in, nobody out. This is supported by 81% of all Californians. A single-payer bill was passed by the California legislature. A couple years ago, Governor Schwarzenegger, thinking he was in another action film, vetoed it. Number two, portability. Even if you're unemployed or lose or change your job, your health coverage goes with you everywhere. Number three, uniform benefits. No Cadillac plans for the wealthy, and Pinto plans for everyone else. There are no high deductibles, caps on payments for care, no protection in the event of a catastrophe. In other words, it's one level of comprehensive care for everyone. Free choice of hospital and physician, which most people don't have in this country. They're assigned a network of physicians and a hospital by the HMOs. Prevention. When you have a single payer, you have a database where you can develop outcomes. And you can learn quickly what works, what doesn't work, what bad medical procedures are used, what better medical procedures are used, what drugs are effective for the purposes for which they're advertised, but they have a bad side effect compared to drugs that are effective for purposes for which they're advertised that do not have such a bad side effect like gastrointestinal bleeding. You end the insurance industry's interference with care. The insurance companies do not deliver health care. They deliver customers. And if we want to reduce the corporatization of medicine and return professional judgment to the medical and nursing professions under rigorous standards of accountability, we must separate that domination of healthcare decisions by the health insurers. It would reduce, as I say, administrative waste, engage in cost savings that I've mentioned, and it would lead to a greater public oversight if it gives a structured role to consumer groups to be vigilant and a monitor. That's the key thing that even H.R. 676, which is a single-payer bill in the House of Representatives, with 83 members of the House of Representatives supporting it, most recent one being Russ Holt from the Princeton area, doesn't have enough attention on giving consumers, the patients, the kind of oversight, monitoring that is the ultimate safeguard for a public health insurance system.